I'm Mrs. Princey, Associate Professor in Mental Health Nursing. There was a 40-year-old married man who had complaints of severe anxiety, low mood, very poor appetite, and also disturbed sleep. He complained about abdominal discomfort, bloating, retching, and always preoccupied with the thought that he was not able to eat food or drink or retain the food. He was admitted in the medical ward and he spent around 71 days in the medical ward for the treatment of dysphagia as he initially presented with the complaints of difficulty in swallowing and retaining. But there was no pathology or organic cause found for this complaint of dysphagia. While he was there in the hospital, he always maintained a very good contact and communication, but also he had extreme psychomotor agitation. His speech was spontaneous with increased speech as well as high pitched tone. His mood appeared to be very low and he seemed to be anxious most of the time. He had no suicidal thoughts and his cognitive function was intact, but he lacked the insight. So, here you can understand by the signs and symptoms of the client. So, what may be the condition of the client? Yes, the topic which I'm going to discuss today is something related to the physical symptoms that the patient will experience without the organic cause. Mostly the cause is related to the psychological factor. Yes, the topic for today is the psychosomatic disorders or somatization disorders. Somatization disorders, a group of disorders in which the condition are disturbed due to the psychological factor leading to emotional stress. So it is the disorder which is caused by the psychological factor rather than because of the physiological effect. If a medical examination is done, we can rule out that there is no pathology related to the physical or organic cause, but the psychological disturbances that you can note, especially related to the anxiety, depression, anger, and guilt. So let us see the meaning of psychosomatic disorder. It is a disorder in which there is a real physical illness that is largely caused by the psychological factors such as stress and anxiety. The examples of psychosomatic disorders are ulcers, headache, allergies, asthma, high blood pressure, and so on. Let us move on to the definition of somatoform disorders. Somatoform disorders are characterized by physical symptoms suggesting medical disease but without demonstrable organic pathology or known pathophysiological mechanism to account for them. So it is nothing but the person will experience the physical symptoms without no organic pathology related to the physiological effect, but it is purely due to the psychological factor. Let us see the history of the concept of psychosomatic disorder. The term psychosomatic was proposed as early as 1880. In the year 1935, Dunbar published the book on emotions and body changes. It is found that during the history of the Second World War, military personnel were exposed to a lot of stress, which contributed to the psychosomatic disorder. So during the wartime, the soldiers were constantly exposed and they were stressed so much that later on the stress they showed it in the form of the physical symptoms. So that was about a brief history of the somatoform disorders. Moving on to the causes. Number one, we have got the stress model. So according to the stress model, there are two facets of stress response. One is the fight and the second facet is the flight. So we have got a mediated response that is mainly related to the endocrine system. Whenever there is a stress, there is something which is happening in the level of the endocrine system. So there is a response from these organs, that is the hypothalamus, sympathetic nervous system, as well as the adrenal medulla. If the person is constantly experiencing the stress, that is the chronic stress, the person may have the serious effects on the health. If he is able to cope up with the stress by using various coping mechanisms, maybe he will not end up with the physical disorders. The hypothalamus, pituitary gland, and the adrenal cortex are mediating the stress response. So that is about the stress model. Moving on to the second cause, we have got the neurotransmitter response to the stress. So whenever there is stress, again we have got these neurotransmitters which are going to act and which are going to regulate the stress response. Stressors activate the non-adrenergic systems in the brain and cause the release of the catecholamines from the autonomic nervous system. These stressors also cause the activation of the serotonin system, wherein there will be increased level of this neurotransmitter, which is the serotonin. The stress also increases the dopaminergic neurotransmission in the mesoprefrontal pathways. So these are the changes which happens because of the stress in the neurotransmitters. The third cause is the endocrine response to the stress. Whenever there is stress, we have got this factor, which is the corticotropin releasing factor, which is being released by the hypothalamus. This factor is going to act upon the anterior pituitary, and the anterior pituitary will release this hormone called as adrenocorticotropic hormone, that is the ACTH. This ACTH at the adrenal cortex level will aid in the release of the glucocorticoids, thereby resulting in promotion of energy use, increase in the cardiovascular activity, and inhibit the functions of growth, reproduction, and immunity. So you understand, whenever there is a role of the endocrine system in response to the stress, the hormones will be released, and these hormones will cause a disturbance in the level of the energy in the cardiovascular system, wherein the client may have the tachycardia or high BP. So these are nothing but the symptoms that the client will experience when he is under the stress. And also the growth, reproduction will be disturbed, and immunity also will be disturbed. So this is about the endocrine response to the stress. The next cause is the immune response to stress. So what is this immune response? So whenever the person is under the stress, he is more prone for ending up with the poor or low immunity because of the inhibition of the glucocorticoids, right? So these are the various responses which happens due to the stressors. Moving on to the theories of development of psychophysiological disorders. So psychophysiological disorders are nothing but the somatoform disorders. So number one theory which explains this psychophysiological change is the neuroendocrine theories. So whenever the person is under the stress, so it is postulated that the emotional disturbance acting through the hypothalamus is going to affect the sympathetic and the parasympathetic systems, wherein the particular organs which these systems are coordinating will have a disturbance. That is nothing but the alteration in the structure of the viscera to which these systems are being innervated. This imbalance in the sympathetic and the parasympathetic system is going to cause alteration in the viscera or the organ systems. Thereby, that's why the person ends up with the signs and symptoms. It can be related to the ulcers or the stomach pain or asthma, any of these conditions which is because of disturbance to the internal body organ systems. The next theory is organ system weakness. So what is this theory of organ system weakness? For example, the person is already having a weakness in a particular organ system. That means the risk factors. The risk factors can be related to the genetic cause, or he may have the problem priorly before he gets this particular psychosomatic disorder. Maybe he has got a very poor respiratory system. So when he is exposed to the stress and is not able to cope up with the stress, so he will be more prone or more likely that he will develop the bronchial asthma, because already he is having a poor organ system, that is the poor respiratory system. The reason can be many things, that is one can be the genetic reason, or it can be repeated respiratory infections which is predisposing him again for these stressors and leading to the bronchial asthma. The next theory is the psychoanalytical theory. According to this concept, the person ends up with the psychophysiological disorders because of the unresolved unconscious conflicts and frustrations. For example, unsolved dependency can lead to development of the fear. Right? So anything previously in the past, experience that the person had some conflicts or frustration in the unconscious level of the mind which was not solved. So when he is having the stress in his lifetime, then he will end up with the psychophysiological disorder. So that is according to the psychoanalytical theory. The next theory is diathesis stress theory. Diathesis is nothing but the physiological or psychological predisposition. So when a person is exposed to the stress, he is more likely to develop the psychophysiological disorders or the psychosomatic disorders. Okay, that is called as diathesis stress model or the theory, wherein predisposition factor is itself the psychological or physiological factor. So this is about the various theories which explain how these psychophysiological disorders can occur. Moving on to the classification of these psychosomatic disorders. Number one, we have somatization disorders. The second disorder is the hypochondriasis. We have got somatoform autonomic dysfunction. The last one is the persistent somatoform pain disorders. So these are the various classifications of the somatoform disorders. So let us learn in detail about each of these disorders. The first one is the somatoform disorder. So in this somatoform disorder, the person experiences multiple somatic disorders or the symptoms in the absence of any physical disorder. These symptoms which he experiences is recurrent and chronic. So you can imagine, chronically the person will have this kind of the symptoms and it is recurrently happening. When you communicate to such a kind of a person, you may end up realizing that what symptoms that he experiences seems to be very vague and something like a dramatic manner, as is going to explain that the symptoms are related to the multiple organ systems. He also has a behavior of changing the doctor frequently for the consultation. So we call it as doctor shopping. He shops for doctor. He goes to a doctor. The doctor does all the investigations and examination. He gets the report that, no problem, no pathology is found, no organic cause is found. But the patient is not satisfied with the doctor's consultation. So he completely believes that there is some problem which is happening. So this doctor is not the perfect one for him. So he keeps hunting for, or he keeps changing the doctor's consultation frequently. There may be the presence of the conversion symptoms, which is very common, like multiple sclerosis, hypothyroidism, pancreatic cancer, and also some form of the psychiatric disorders like schizophrenia, hypochondriasis, conversion disorders, delusional disorders, and so on. Right? So this is about the somatization disorder or somatoform disorder. Moving on to the second type, which is the hypochondriasis. So what is this hypochondriasis? The persistent preoccupation with a fear or belief of having one or more diseases based on the person's interpretation of normal body function or a minor physical abnormality. So, what is this condition? Hypochondriasis. Persistently, the patient or the client feels that he or she is having one or more disease condition in spite of no organic cause or pathology. So, if such a person goes for a consultation, the doctor may just examine him and finds no physical abnormalities, is always preoccupied with the medical terms. So that means he does lot of research to find out some medical related terms related to the physical symptoms. Okay, so that kind of a behavior that you can note in the hypochondriasis condition. And also the change of physician is also common. So he keeps on shifting from one doctor to another. He does the doctor shopping. The next disorder is the somatoform autonomic dysfunction. So, in this condition, the person experiences a physical disorder that is mainly related to the autonomic function. That means the organ systems are under the control of the autonomic nervous system. For example, he may narrate the symptoms related to heart and cardiovascular palpitations. So he may just say that always I can feel my heart beating, right? The palpitations that he can experience. Or it can be upper GI problems like constant hiccups that he may have, lower GI, problems like irritable bowel syndrome, flatulence, respiratory system that he can experience hyperventilation, right? Tachypnea. In the GI system, he may complain about painful urination or dysuria and various other organ system complaints that he can ventilate. Okay, so that is what the person feels, that he is experiencing the symptoms which are related to the autonomic, nervous system, which is actually not under the control. Okay, so that is called as somatoform autonomic. The last disorder is the persistent somatoform pain disorder. So in this condition, the person persistently complains of severe and distressing pain, wherein the main feature, that is the pain, is not related to, he is always preoccupied with the pain, complains about the pain in one or the other body systems, and especially this kind of complaints is found in the female gender. Persistent somatoform pain disorder is mainly seen in the female gender. He explains that the pain is not generated intentionally and he is not able to control the pain. So that is what the client may just ventilate related to the pain. Okay, so that is about the various psychosomatic disorders. Moving on to the clinical manifestations. So if you take the clinical manifestations, is mainly we can classify them according to the various organ systems. If you take the GI system, there may be conditions, that is the physical disorders, which is because of the psychological factors, like we have got the peptic ulcer, ulcerative colitis, anorexia nervosa, and irritable bowel syndrome. If you take the cardiovascular system, we have got the essential hypertension, angina pectoris, myocardial infarction, cardiac neurosis, and paroxysmal tachycardia. In the respiratory system, the disorders which can contribute to the psychosomatic factor is the bronchial asthma, vasomotor rhinitis, and hay fever. The next system is the genitourinary system, wherein we have got the impotence, fragility, menstrual disorders like amenorrhea, dysmenorrhea, menorrhagia, and premenstrual tension. Endocrine system, there may be conditions like hypothyroidism, that is the Graves' disease, diabetes mellitus, and the obesity. If you take the integumentary system, you got the urticaria, psoriasis, hyperhidrosis, neurodermatitis, If you take the musculoskeletal system, we have got the rheumatic arthritis. The vasomotor conditions that we have is the migraine and tensional headache. So these are the various disorders which can be because of the psychological reason. So these are termed as the psychosomatic disorders based on the various systems. The next one is the diagnosis. How do you diagnose this condition? The first thing that you do is a physical examination, right? When he goes to a consultation, the doctor has to perform the physical examination to find out the medical or the neurological conditions. The second thing is he has to collect the history or the information with the emphasis on the current psychological stressor. So what is the stressor the patient is undergoing currently, which can be the reason for this somatoform kind of the disorder that he is experiencing. The next thing is that he may ask the client to undergo some laboratory test to find out if there is really underlying organic cause. So these are the main diagnostic studies that the client may have to undergo with a psychosomatic disorder. The next is a treatment. So what is the treatment option? Since this psychosomatic disorder is closely related with the anxiety, right? So anxiety, it can be related to that persistent belief that he is having a serious disease or a symptom or a disorder, right? So it can be because of the anxiety, or if the person is having the psychosomatic disorder, he can end up with being very anxious or being depressed. So you need to give the psychopharmacological agents to treat the symptoms of the client, the psychological symptoms. So we have got the drugs like the antidepressants, benzodiazepine group of drugs. Apart from the psychopharmacological agent, we have got the psychosocial therapies. So in that we have got the supportive psychotherapy. So the main thing here is we do not require an expert person to just bring about change in the cognition or behavior of the client. We just need a support system. That is, it can be the family or the friends who really is going to support the client to, be with the client and make him realize that it is purely psychological, right? So a supportive psychotherapy may be required for such kind of client. And also, since he is having a lot of anxiety and stress, he may have to undergo the relaxation therapy, right? So he can be put on the various relaxation techniques so that his stress and anxiety can be reduced. So the next therapy is the behavioral therapy. Very important, since the patient is having this kind of a behavior. You need to modify the behavior of the client. So he may have to undergo the behavioral therapy and bring about a modification in the behavior. The next treatment option is the biofeedback therapy. So what is this biofeedback therapy? The patient will be connected to certain instruments, like it can be the BP apparatus or ECG machine or the temperature machine. So all these things that he will be connected with such kind of an instrument to just ensure and make the person realize that he is not having any kind of changes in the physiology, and he can have a control. That is, all his system can be controlled voluntarily by himself because it's purely psychological. So through the biofeedback technique, he is able to have a control on certain, functions, like it can be the BP, skin temperature, muscle tension. So all these can be controlled by himself. Maybe when he's connected to an instrument, say for example, the BP apparatus, okay, he can undergo some relaxation therapy. Thereby, he can have a, self-monitoring level of the BP that he can have a monitor, and he can have a voluntary control on these particular aspects. Okay, so that is called as the biofeedback therapy. So that is the treatment option which is available for the psychosomatic disorder. Moving on to the nursing management. So when it comes to the nursing management, as a nurse, you should be able to do the nursing assessment. So nursing assessment includes the complete history collection. You need to find out the history of the client and find out what is the psychological stressor that he is, presently undergoing. And you should be able to list down what are the symptoms that the client is having and give the treatment accordingly. So our goal is caring rather than curing. So what is this? A psychosomatic disorder is not that it requires a medication therapy for the physical condition to be cured. No, we need to do the care. So we need to be very much conscious that you bring a reinforcement in the client to give him the education, give him the various relaxation techniques so that he will be able to understand or gain an insight about his illness. So our goal is for the care rather than the cure. So here the next thing is management is more realistic than the treatment. So we are not going to give him any kind of medications for these physical disorders. No, we are going to make the patient to understand the condition in a realistic way. We need to have a therapeutic relationship, very very important. The patient should gain the insight about his condition. So as a nurse, it becomes a very important role that you maintain the therapeutic relationship, communicate effectively, build the rapport so that the patient will trust you and will gain the insight into his condition. You're going to rule out whether the patient is having any kind of the psychiatric problems like depression or anxiety. And if the patient is having such kind of a psychiatric problem, you may require to coordinate with the psychiatrist with the psychopharmacological agents. That is, you will be playing a role in administration of the antidepressant drugs, the anti-anxiety drugs, or the benzodiazepine group of the drugs. You also see to it that you make the patient realize or you educate the patient that investigations are not necessary. So you convince the client to avoid investigations without any appropriate indications, right? Unless and until the patient is indicated, definitely he requires an investigation. So till then, you avoid the investigation. Teach the patients about the coping skills for the management of the stress. So various stress coping skills or techniques that you're going to teach for the client, and also make sure the client brings about some changes in his lifestyle, right? It can be related to the diet or exercise or following the right habits. So all these things which is going to make the person to get relieved from the stress and tension, thereby so that his anxiety will be under his control and he can lead a normal stress-free life and also get freed from this psychosomatic disorder. So this is about the nursing management of the somatoform disorder. So somatoform disorders are nothing but the physical symptoms that the patient are experiencing because of the psychological factor, not really because of the physiological, cause. Right? So, and this can be controlled by the patient. Only thing he needs a support system and needs the education to overcome this stressors in his life. Hope you all have understood the topic. Thank you.